As the governor mentioned, we do now have 288 cases in 17 counties across Illinois. I'm not saying this lightly, but unfortunately, the grim truth is that these numbers will continue to grow significantly, as will likely the unfortunate statistic of fatalities. Yesterday, we did tell you about outbreak in a nursing home. Long-term care residents are our most vulnerable population and at the greatest risk of severe illness. That's why to prevent introduction of the virus into the nursing homes, we need to protect the healthcare workers who provide care to those residents from infection. We need to make sure that our healthcare workers are healthy and that they have the appropriate PPE. We are screening all healthcare workers before they present to work in the nursing home to make sure that the people charged with caring for our elderly loved ones are not the ones bringing the virus into them. And likewise with visitors, that is why it seems so harsh, but it's why we have to keep visitors out. We know that visitors wanting to see loved ones are also transmitting this virus, bringing it into the nursing home, again, putting at risk the people that they care for. Limiting visitors will decrease the possibility of this virus affecting our most vulnerable and will limit the spread. These actions are not taken lightly and are not meant to be cruel. Quite the contrary, we're trying to take care of our residents. It will take every single person in our community to do their part to break this cycle. We have to break the cycle of disease transmission. That means if you're ill and you're otherwise healthy and you think you probably were exposed to a COVID case, but you're healthy, you can weather this illness. You don't need a test. Assume you have COVID and stay home. Stay home and don't transmit it to another person. We need to keep those hospital beds for critically ill people and not for people who would have gotten well on their own at home. If we can keep those beds available, we don't want to see a situation where we have more people that need a bed than we have beds and have to decide who gets care and who doesn't. So that's what we mean when we say flattening the curve. We don't want to overwhelm our healthcare capacity. And so people who can stay home and be safely, again, there's no specific medicine. So if you can stay home and weather it out, you are doing a tremendous part in creating a bed for someone who really needs it and whose life can be saved. So everyone has a role. If you have a mild illness and you're healthy, stay home till you're well. If you're a senior, stay home. You have earned the right to stay home and have one of your community members drop some food off for you at your door. Let the community work for you to keep you safe at home, away from gatherings and large groups that could put you at significant risk. If you're a kid and you're home from school, which is all of our kids, don't undermine the school closures by now creating play dates with a bunch of your friends that you would have been at school. That just negates the benefit of the school closure. If you're a tween, the same thing. Don't call everyone over and socialize. We've got to limit our exposure at all levels, every age. The fewer people you're exposed to, the lower your chance of contracting the virus and then transmitting it. The drastic steps we're taking now are what we have to do. Closing the schools, closing the restaurants, but it will decrease the number of people who become infected, and that's what we want. With fewer people infected, there's less illness. With less illness, fewer people need care. With less people needing care, less people needing ICU beds, which of course are limited. We can't strain our healthcare system beyond its limits and then be choosing who gets care and who doesn't. Let me start by thanking Team IDPH, the Illinois Department of Public Health. We usually work behind the scenes, right? We are looking out, surveilling for pertussis. We're keeping track of HIV rates. We're making sure people are getting their medicines. We like to do our work in the background, but right now we're front and center, and we've had to ramp up our efforts to be able to handle this new COVID-19. We were the first state in the first public health laboratory to be able to run this test, and it helped us to identify infections quickly without having to send it to the CDC. We've been working around the clock with meetings starting at the 7 a.m. hour till meetings at 11 and calls going into the wee hours of the morning. Again, I'm just saluting all of my team IDPH members and saying thank you for the tireless days. People have been working 7 days a week for weeks now. I also want to thank the local health departments. They are boots on the ground for their hard work and their response to the outbreak. They are critical in our effort to limit the spread. The local health departments will have the most up-to-date numbers because of the rapidly increasing number of cases and coming from different places. You know, we are running the tests. We have individual hospitals that are running their own tests. We have commercial labs that are running their tests, but we're trying to assimilate all of those test results, and that takes time. So we can't update our website in real time. We'll be updating it once a day. But if you look at your local health departments, you might see their information updated quicker than our daily update. Again, we'll have these daily press briefings so that we can keep you up to date and let you know what is happening. In the meantime, I want you to know that we are not able to break down the information for you necessarily by county, but again, use your local health departments who will be able to update their information more regularly. I again want to ask everyone to do their part and help us break the cycle of spread. And that means staying home as much as possible. It will take every single one of us making every sacrifice that we can to reduce the spread of this virus and free up our healthcare system to care for those who need it most. Every action each of us takes as an individual has an effect on the entire community. Let's take as many actions as possible to help our community weather this extraordinary situation with the lowest loss of precious lives as possible.